Friend of the show from Reproductive Care Center, Dr. Maas. We have her on the line. How you doing, Dr. Maas?
I'm great. Happy Tuesday. It's nice to connect again.
Yeah, nice to talk to you. Hey, I just wanted to ask you before we start talking about RCC a little bit, did you hear about the trail runners up Mill Creek on Sunday morning, trail running pipeline, that trail?
I did. I was nearly there myself, actually.
Okay.
Decided on a different trail, but was debating between the two. I'm glad that the runners are doing okay and that they got the mountain lion.
Yeah.
Geez, that's scary.
It is scary. And so the reason I'm bringing it up for people that didn't hear it, so it was they had a run-in, this mountain lion, it was startled, and then it attacked one of the runners, kind of scratched her leg up a little bit. Have you seen it? Because I know you and your husband like to do the trail running thing. Have you seen any mountain lions up in the mountains?
Yeah. You know, we haven't. My understanding is if you see them, you're in a bad situation because they're pretty elusive. So thankfully we haven't. Plenty of coyotes, rattlesnakes, moose, deer, all those good things, but no lions, thankfully.
Right. Well, you know,
how about yourself?
Yeah. I have seen them on, not like runs and stuff like that, but I've seen them on hikes, and and they usually say it's like, I don't know, they see you, that's for sure.
Yeah, I see them online. Yeah, I see them online. I don't go outside. I'll just Google that. I don't need to be close.
So we got to ask
I'm with you.
This question here. So this is a great question. How long should somebody try before looking into Reproductive Care Center, RCC?
Yeah, great question. So a year of trying is traditionally what we define as infertility if you aren't able to achieve a pregnancy, or if you're over egg age 35, 6 months of trying, or even sooner if you're in your 40s because egg quality and quantity decline over time.
Yeah.
Or if you have any health problems as well, if you're not having periods and you're clearly not releasing an egg, and darn it, we need an egg to create a pregnancy. So if you're not having periods or other health problems anytime, we're happy to see anybody that has questions or concerns.
And you had brought this up the last couple of times Dr. Maas was in the studio. If it wasn't for them, I mean, they essentially saved your life.
Yeah, I was thinking about you guys in the shower today when I was naked. I was like washing all my parts, and I was like, thank God, because we went to you guys for fertility, but you ended up saving my life and finding all this precancer stuff, and so thank God I was able to get in with somebody else that you guys referred, I think, and got everything all cleared up. But yeah, it's hard because, like she's saying, it's a good thing to protect your fertility, because I have so many friends that are my age now, which is mid-40s, and we gripe about it. We're like, you teach us about the birds and the bees in elementary school and give us the basics, and then there's nothing about protecting your fertility as you get older,
Oh, absolutely. That's exactly why I do what I do. I think back to sex ed, if you can call it that, back in elementary school, junior high, high school, whenever you saw it, and it was just don't even look at the opposite gender, or you're 100% going to be pregnant. And that's not the truth.
Yeah.
As good as it gets is 22% chance per month. So it's not a high statistical probability, and 1 in 8 couples struggle with infertility. So very common.
Well, and I remember my wife Tammy and I, when we started, and we tried for, it was about a year, and then we realized that it wasn't happening, and she found out the hard way. She was about mid-40s when we went to talk to you guys and found out that news that I think most women, or at least then, I mean, I hope it's getting better as far as the message getting out there. Like when you're in your 40s, like you said, like the eggs,
it declines.
Yeah. And she was shocked. She didn't know. Nobody told her.
True. Yeah, I had no idea.
Absolutely. It's better and worse. I think we're more educated, but then we're also having, 50-year-old celebrities that don't tell you the backstory of how they're building their family. And people are like, oh, she was 52. She got pregnant. It's super easy. And you're like, well,
yeah.
You don't know the exact way that individual created the pregnancy. Maybe they froze their eggs. Maybe they used donor egg. Maybe they used donor embryo. But all you see is a 52-year-old carrying a pregnancy, which it's not always that straightforward.
Good call. And here's another good question. So what role does the male have in the diagnosis of infertility?
Well, I've never created a pregnancy without sperm.
Yeah.
But about a third of couples have male factor infertility, and that could be quantity of sperm, that could be quality of sperm, ability of sperm to fertilize, it could be genetic abnormalities. There's a multitude of male factors, which I'm at least reassured by the fact that in Utah, people are pretty willing to undergo treatment and assessment, both male and female individuals, everybody walking in the door. culturally, some cultures kind of make infertility a woman's problem, which really it's not. It's a couple's problem. You're not going to get pregnant on your own. You're not going to create a pregnancy on your own. You need both sperm, both egg, and uterus to create a pregnancy. So it's a group problem per se.
Well, and since we're talking about it, I'll put it out there. I mean, I had
UNA plus.
I had before Tammy started. I mean, I had some stuff done. The boys down there, I had a procedure done because they weren't sure if there were some, let's just say, veins, right? And they removed some of them because I guess it could potentially have been warming up the sperm where it was too warm to. So I went and got that procedure done before Tammy and I kind of went. But it was because of you guys. You guys said this could be a potential problem. So that was good that you told us. You know.
Well, and men can release fluid when they have an erection and not have sperm in it, and not know unless we put it under a microscope. You can have absolutely no symptoms other than difficulty creating a pregnancy. And it's reflective of general health. I think you're the key example of that, where just because the sperm is abnormal and we can treat that with things such as IVF or insemination, where we're putting the sperm into the uterus or putting sperm directly into the egg, it's reflective of general health and well-being, and we may uncover other things like the vein issues or heart problems or kidney problems or genetic problems that are more systemic and really need to be assessed and treated in the short term and long term for general health and well-being.
I was going to ask you real quick, just because I have a lot of friends and I also have PCOS and endometriosis, irregularity with the cycles. What would you suggest to people that are maybe in their 20s or 30s and they have these things? They're not ready for kids, but they know one day they do want to have a family. Like, what would you tell them to do?
Good question.
Yeah, absolutely. I would say get in with a regular gynecologist for assessment. Most routine OBGYNs will help you manage this in the short term. And of course, if you have questions on how these are going to impact fertility or reproduction in the short term or long term, we're happy to see you here at RCC, or you could see a reproductive endocrinologist who could help you with your family planning. PCOS and endometriosis are a little different. Endometriosis can be associated with lower egg supply or poorer egg quality, whereas people with PCOS, I'm sure you're well aware, have to manage their periods and make sure that we're preventing the lining of the uterus from thickening and becoming precancer or cancer because you're not shedding it every single month with those irregular periods.
Good advice.
So if you're having problems starting a family or adding to your family, we can't thank you enough.
Yeah.
Our little boy Axel is you guys are the reason that we have him. So thank you. Hey, we got to end on a funny note here. So I don't know if you've got a story. You've got to have a story with the naked topic.
Yeah.
So did somebody see you naked that wasn't supposed to, or vice versa? You walked in on somebody that you weren't supposed to see naked.
I answered my door in a state of undress that I was expecting only my husband to be on the other side. And lo and behold, it was his employee and his wife who were coming over for dinner. And, I sprinted up the stairs real quickly that day.
She said she's a trail runner.
Right? Thank goodness. But they're all bits and parts at this point. You know, as a gynecologist, anything's the same as an elbow to me.
That's hilarious.
That's awesome.
You're awesome. We'll talk to you soon, Dr. Moss.
Good.
Thank you.
Thanks. Take care. Bye.
Have a good Tuesday.